So for my thesis, I explored children's, EPs, and SENCos views about children's involvement in the education, health, and care process. So I guess a good place to start is with a brief overview of the legislative context. I won't go into a lot of detail, but essentially, since the middle of the 20th century, there's been a gradual change in attitudes towards children and children's rights. And one of those big changes was in 1989 when the UNCRC recognized the rights of children to express their views and to have those views influence decisions that are made about their lives. And this article, or this bit of legislation, had a very important impact on UK policy. And we saw the Children and Families Act come out in 2014, which addressed children's Article 12 rights. And that was followed by the SEND Code of Practice, which introduced the education, health, and care process, which emphasizes children's participation in making decisions about their education. So this is the legislative climate that we find ourselves in currently. And before I talk about what this actually looks like in practice, I just want to first talk about why these changes in policy were made in the first place. So why is children's involvement important? There's two main reasons why children's involvement is important. First, it's that children themselves prioritize and value their participation in making decisions about their lives. They want to be involved. And second, research has found that when children are involved, plans that are created as a result are more personalized and more effective. This is linked to motivation theory and the important idea that if we want to affect real change, we should do with rather than to children. So there's evidence that children's involvement is important, and legislation and policy recognize that. But the question then is, what does children's involvement look like since the introduction of the education, health, and care process? And research has found that when children are involved, adults say that the involvement has provided valuable insight, and children themselves feel valued and empowered by their participation. But despite this, children's involvement has been inconsistent and is not yet fully embedded in practice. And that was found in a very large-scale national survey. And the survey also found some reasons why there's this inconsistency. And essentially, they found that younger children tend to be less involved than older children, and children who have particular kinds of special educational needs, in particular language needs, tend to be less involved as well. So from this research, we can see that there's a sort of general concept of less involvement and more involvement. And to understand that a bit more, turned to some models of participation, two models in particular. I know they're very small on there, but the one on the right is Hart's model of participation, and the one on the left is Lyndys Model. So just to say a little bit about Hart's model, it's fairly self-explanatory because it's sort of a ladder. And the idea is that the bottom rungs of the model represent practices that are less participatory. And the higher you climb the ladder, the more participatory practices become. So at the very top of the ladder are practices in which children are considered to be equal partners in all aspects of decision making. And this is a little bit idealistic, but that's what you're aiming for, I suppose. In Lyndys Model, she talks about it a bit differently, but her model sort of emphasizes that true participation not only lets children share their voice, but also allows their voice to influence decisions by giving them an audience and a space in which to share their views. So in the context of the education, health, and care process, this means that children should be encouraged to share their views, but also that those views should impact their education, health, and care plans in some way. So for my thesis, I was interested in learning what children's participation looked like currently in the local authority where I did my placement. And I wanted to understand that through the perspectives of EPs, SENCos, and children themselves. So these were my main research questions. I will skip ahead. So in terms of my methodology, my research was anchored by social constructionist principles. And I did some semi-structured interviews with adults, so those are the EBs and the SENCos, and with children. The children were in Key Stage 2. I chose to focus on the younger children in particular because most of the research that has been done is with older children, and I was interested to see what will happen in primary school. And I did separate interviews or separate interview schedules for the adult and the child participants. And in particular for the children, I used some visual communication aids. And I did this because I wanted the interview to be accessible, or at least as accessible as possible to children, so that they were sort of engaged and I could get, I guess, richer data. For the children, the questions were sort of presented verbally, but they were also presented visually, and you can see that in the image right at the top of the screen. So I sort of presented them in both ways. And children also had some support to give their responses. So there were some prepared cards that I made which had possible responses that children may want to give. But in order to not limit them to those responses, children also had the option of drawing their own responses on blank cards. And of course, the children were also sort of verbally engaging in the interview. And yeah, so then I transcribed all of that data and I did some thematic analysis. I did this separately for the 3 groups of participants. Okay. Right, so in terms of the findings, it was very tricky to put this all into a slideshow, but I've tried to sort of show the different themes that emerged. There were 3 themes that emerged from the children's interviews. You see them here in red. There were 6 themes each from the EP and SENCo interviews. The EPs are in green and the SENCos are in blue. And I've arranged them in this way because there was some overlap and some similarities in the themes that came out from these different groups. And so you can sort of see that. It's not the best representing, but hopefully you can see that. And just in terms of the general sort of findings, I think my research really reflects previous research in that the experiences of the children was very varied and inconsistent. So out of the 5 children that I interviewed, 4 children had been asked to share their views in some way, but only 2 children were invited to do so at meetings. And very unfortunately, none of the children seemed to have had any influence on the decisions that were made in their final plans. So although views were sought, they didn't seem to be taken into consideration when plans were finally made. And so the adult participants, the EPs in particular, had some questions about the genuineness of children's involvement, so that even when it appeared the children had been involved, they were concerned that perhaps this was a bit tokenistic and more of a sort of tick box exercise rather than genuine involvement. The EPs and SENCos also spoke about different roles of the adults. Then, in terms of how children's involvement was perceived, it was generally valued, but despite being valued, was not prioritized by the adults for a number of different reasons. One of the primary reasons being the number of systemic challenges that they faced in trying to involve children. They also noted both positive and negative impacts of involving children. The positive impacts being gaining more insight and better understanding of children. And I'll talk about the negative impacts in a second. In terms of factors that acted as barriers, generally with children's capacity, coming down again to their age and language needs, systemic challenges in terms of time and access to children. SENCos talk specifically about their own knowledge and skills and the knowledge and skills of other school staff in knowing how to involve children. That was actually a very significant barrier for them. And children specifically talked about relationships and agency as factors that facilitated their involvement. And I'll talk about them here on the next slide, where I want to mention some of the, I think, more key things that came out. The first being that all of the children that I interviewed spoke about how much they valued having the support of a familiar adult. So it was really important to them that the person that sought their views was somebody they knew well and somebody that they trusted. Generally, they spoke about teaching assistants. And they also really valued having agency over their participation. So they liked to be able to control or have choice in certain things, even small things like choosing where everybody sat in the meeting or choosing what snacks to serve. They really valued those opportunities. The second really important thing that came out was that adults consider children's emotional coping skills and their emotional, sorry Ed, nearly finished, and their emotional readiness. So they thought about whether children would be able to manage being in large meetings, or whether they would be able to sort of cope with hearing difficult things in those meetings. And they considered, I guess, alternative ways, the more appropriate ways of involving children. I spoke a little bit already about the knowledge and skills, so I'll skip past it. But also just to say that EPs seem to have a very unique role because they do possess the knowledge and skills to be able to do that, and they felt very confident about it, which brings us nicely to the implications. I'll start with the EPs because that's where we left off. The EPs have a significant role in promoting children's participation by setting this expectation with schools they work with. So regularly having conversations with SENCos about how to involve children and thinking about appropriate ways of doing that. Also by supporting schools and SENCos to develop their knowledge and skills on methods of involving children and getting them to share their views. In terms of SENCos, it is just to have a more generous and empowering view of children's capacity and being curious and seeking to involve children, because then there can always be support on how to do that. So I guess it kind of starts with the attitude of wanting to do it. And also giving children the choice and control, as much choice and control over their participation as possible. And finally, just the policy, the SEN Code of Practice emphasizes quite strongly that children should be involved, but it doesn't really say how. And I think that's really important. That's what's missing from the guidance. And I think by adding that, it will, I think, take away a lot of the anxiety that schools and SENCos face. And will also give them, because they do have the intention, they just don't have the means at the moment, or at least that's how they feel. And so by changing that, I think that will help a lot more children to be involved in the process. And I'm done. Thank you.